If you replace the I in illness for we, you get wellness.
Oh my God, that's amazing. And I was like reconfirmed that your values were the same as mine.
Welcome to the Dr. JJ Thomas Podcast.
Hello, everybody. Welcome to the Dr. JJ Thomas Podcast. I'm JJ Thomas, and I'm so happy for this episode today. I've been really looking forward to this because it's the first episode we have a guest. And I couldn't think of a better guest than my friend and colleague, Eric Abramowitz, Dr. Eric Abramowitz. It's super fitting that he's here as my first guest today because he was my first physical therapist that I hired in the cash-based practice that has been with me so long and has just been amazing. So, Eric, welcome.
Thank you. Happy to be here.
In this episode, I'm so excited to be here with Eric because honestly, I've been talking for 15 weeks about all the things, all the nuggets that have made this practice a success. And I realized that Eric, is another person who's come in and taken his practice and grown it exponentially in a way that I couldn't be more proud of. And I think you're pretty happy with. So I wanted to share those things with you guys. Eric, I wanted to tell them a little bit more about you. And I thought I'd start with how you and I first met and how this professional relationship kind of grew.
Sure.
So I love this story because it's, it's one of those things, one of those moments that I look back on and I'm like, wow, sometimes have you guys ever been in the situation where there's a moment in time where it feels like things stop and there's clarity of vision, and you don't necessarily know where that's going to go, but you have a distinct moment that you remember that you're like, wow, this is an important moment in my life. When I first met Eric in 2012, it was probably late 2012, I was working at ATI at a large insurance-based company, great company. And Eric, I'd never met Eric before, but he'd been working there a good bit. And at the time I was doing dry needling, and my PT mentor, had sent Eric to me to consult with a patient that he was having a hard time with. And so that moment, that time when Eric came, it was funny. The interaction was very, on surface, very, obviously professional, but it was not very intense in terms of our interaction, but the way he held himself, the values that he portrayed in that conversation, working with this patient, there was multiple things that I looked at Eric and I was like, wow. I remember the distinct moment we were recapping after the patient left. And I remember thinking, wow, this guy's awesome. I'm going to remember him. And I'll tell you in a little bit how that came back to me in the next year. But at the time when I had that thought, I wasn't even intending on opening my own practice yet. I had dreams of it, but I wasn't there yet. I wasn't ready to take that jump. But in that moment, I was like, this guy's awesome. I'm going to remember him. Literally, I remember saying those things. And I would love to hear your perspective on that first day.
Yeah. I mean, for me, that was maybe a year or two into being a PT, and Paul Schweitzer, who was one of my mentors, you happened to work for him for a while. And, I'd been in a year. I've been trying to follow Paul around the office as much as I can. Some of for those that know Paul or don't, his treatment techniques, he had been in the physical therapy game for a while. And, all of his methods seemed somewhat far-fetched and out there compared to what you were taught in PT school. Right. In PT school, there's a lot that goes by the book, and there's particular methods of doing this exactly this way. This is the precise way. You're going to be tested on it this way. And you walk into the office and see Paul doing something so unconventional, standing on a table doing a hip mob with his foot. You're like, what is this guy doing? Yeah. And I just had this interest in something this guy is doing is different, unique, and special. And his patients loved him. He got results. Docs loved sending patients to him. So I knew there was something about his methods and his personality, and something was special. So I'd always follow him around, and I had a patient, an athlete, a high school lacrosse player was dealing with an injury, and we might have been 6 weeks into the treatments and weren't getting the results I wanted. And I went over to Paul, ran through the case, and I said, hey, what can I be doing here? And he goes, go over to this chick, JJ, down the street. She does dry needling. It's kind of crazy, but I promise you'll get some results. So I, jumped on it, said, okay, reached out to you. I think I emailed you. I said, hey, I work with Paul, wants me to come take a patient over to you. Do you mind doing a consult? And, you know, I walked in the office, watching you do that treatment that first day. I had never seen dry needling. I don't think we were taught about dry needling in PT school at the time. So it was new, different, you know, invasive. So I was very intrigued. And honestly, the patient was fixed in 2 sessions. So I had been working with her for 6 weeks, 2 sessions, seeing how you interacted with her, seeing how you tested and retested, and the movements and things you looked at was so out there for what I've been used to and what I've been doing. And just my personal desire to like grow and change. Like I just had a feeling that this was a path of some sort that I needed to pursue.
Yeah. That's awesome to hear that, because to be honest, those are the things that I saw in you that day. Like the passion, I think. And this is important. I want to bring this to you guys as an episode because I think it's important for you guys as professionals to self-reflect and ask yourselves what impression you're portraying to the people, to your coworkers, to people that you want to have a relationship with, but maybe you don't even know you want to have a relationship with them. That's the best thing about like this interaction with Eric and I is at the time I had no idea that I would want to have a professional relationship with you other than the fact that I was like, wow, I'm going to remember him. But all those things you just said are exactly why I had that defining moment where like in my mind, I literally outside in my mind said, I'm going to remember him. And it was that. It was your passion for learning. It was your humble but respectful questions. It was your genuine interest. And I knew right away that our values were going to be aligned. And I just was like, this is somebody that I want to work more with. So I don't know. When I was thinking about this episode today, that was one of the most important things I wanted to share is because I think you never know when you're going to affect someone else. Like, I think that we all sometimes run around this busy life, so busy, and like we think we're in one direction, but there may be a whole nother direction that's going to come our way if we just keep our eyes open and are looking for it. The other cool part about when you and I first started working together, like how that transitioned from me having this moment where I was like, I got to work with this guy, he's amazing, to actually bringing you to my clinic, I think happened. So 2012, late 2012, we met. And I had that moment where I was like, this guy's awesome. We have to work together somehow. And then middle of 2013, I'd hit my limit. Like I just was done. I was fried. I'm that way in general. Like I'm like very patient and I'll work hard. And then all of a sudden I'll hit a limit where I'm like, screw this, I'm totally done. And that was it in 2013. And I left ATI on good terms. They're great people, as I've said 1,000 times. But I left ATI, I opened my own practice, and I've discussed this on the podcast before, like how I actually did that, which isn't my intention for today. But remember, I kind of did it. I didn't have a brick and mortar shop the first 2 years. It wasn't until 2015 that I actually went and got my own, brick. And then, so 2015, I was busy enough. I had my own clinic, actual location, and it just was snowballing in a good way. Things were just cruising, and I was busier and busier. And around 2017, I was like, shoot, I'm having a really hard time getting my patients in now. I am like I got into this because I want to help more people, and I am helping more people, but now I'm pretty, I was coming in, I was treating patients at 5 a.m. I was coming in a lot on the weekends, which I don't mind doing for the good of the patients, but like I was just hitting a point where I was like, oh, if I don't do something about this, I'm going to burn out. Then all of a sudden, that moment of us reconnecting, of us talking after we had that patient, that moment came back into my head, and I was like, I wonder what Eric's doing. And just for you guys to understand, like Eric and I, we didn't work together at ATI. Like we had that one time, and then we had some interactions through Christmas parties or whatever, and Instagram, but mostly we didn't. And then we were following each other on Instagram, and in 2017. You came back into my head because of something he posted on social media. So I was literally one of those days, I had a long, long day, and I was like, oh my God, I love what I'm doing, but I need some help. Who can I hire that's going to be great in this? And then I saw this post. Oh, actually, first there was a jiu-jitsu post. So I had just started jiu-jitsu then too. And then Eric posted that he did a competition, and I was like, oh, Eric does jiu-jitsu? He's totally perfect for this. And then right after that, he posted this, he reposted a phrase.
It was if you replace the I in illness for we, you get wellness.
Yeah. And I saw that. I was like, Literally, it was, I think it might have even just been on your story. I don't know, but it was like a brief, it was like, if you replace I with we, illness becomes wellness.
Yeah, that's it.
And I was like, oh my God, that's amazing. And I was like reconfirmed that your values were the same as mine and that this had to happen. So I reached out to you on DM and I was like, Eric, how have you been? And he's like, I'm so great. They just made me director at ATI.
Yep.
And I thought, okay, I'm not gonna disrupt his world. Like, he's very happy. I'm not gonna interject him from that. So I just let it go. I was like, congratulations, that great. Meanwhile, I was like, ugh. But then, so I survived. I did try a couple helpers here and there. Nobody quite was the same as Eric. So then 2019, I was like struggling again, very busy. And I literally went back to my DM to see when the last time I asked you was, and it was 2 years before. And my exact thought was, 2 years managing a busy insurance-based clinic, he's done. I texted you and I was like, hey, how you doing? Are you ready to come work at Primal now? And then we got on a phone call and that was it. Then we just figured it out. And that was like, that became into COVID times. So it was like a bit of a risk, I think. Like, a lot of people weren't growing during COVID times, but I knew it was right. I was still really busy, and I knew that in order to grow, I needed other awesome people that were following the same vision and mission that I wanted to.
Yeah, it was definitely a risk, but like you said, I mean, I had been the clinic director of the office that I started at with Paul, and that was in my mind starting out at ATI. And, I always envisioned like, man, this is my goal. I want to be clinic director of this place that we're doing, it's 140 visits a day. We've got 30 staff. I'm like, if I can manage this monster, like, I'm good. I got it. And, it took me a few years. I got my first office to be clinic director, smaller space. They bumped me to another one. I had done a good job. And then that third office was back to Pike Creek being clinic director, where that's when you texted me that first time. And I said, hey, I got this job. I'm super pumped. This is going to be a great opportunity. And that was a tough job. I definitely learned a lot being the clinic director of that office. I don't want it to seem as though that was all negative, because there's a lot that came out of my experience having to manage people, interact with staff, and be supportive of their goals and their mission and what they want to get out of their career, while also still taking care of patients and feeling like I'm fulfilling my job and why I became a physical therapist. Yeah. But yeah, 2 years of all of that, like you said, like it gets overwhelming, and I started to feel the burnout. So you definitely caught me what felt like at exact the right timing. And it was certainly a risk to take the jump, and I did it systematically and little by little, but when it was time to take the jump, it felt very right.
Yeah.
Yeah.
I would love, like, that's part of what I want to get across to these guys today, is like to share your perspective on that exact thing. Because I think when I'm getting feedback from the podcast and from people that are just reaching out to me asking about the cash-based practice, I think that's the biggest fear, is that jump from the insurance-based world and then transition into a cash-based practice. And I would love to hear more about how you felt during that. Like maybe some of your fears that you had before coming over, and even while you were first starting to transition, some of those fears that you might have had and how you dealt with them.
Yeah, that's great. I think to understand the fears, for the physical, all us physical therapists that start in the insurance-based world, for the most part, I think we all start with the same drive, passion, and intention to say, hey, I want to make a change in people's lives. Mm-hmm. And that is everything I want out of this career, to show up to work every day and make a change, and have the time I need to dedicate to each individual patient to make sure they're getting what they need from their time with me. Mm-hmm. So what ended up happening, at least in my experience, you get into some of the insurance-based constraints. I don't necessarily think it's an individual company constraint, but that's the insurance-based world, the constraints where the only way to be successful seemingly in that environment, because of reimbursement, is for you to see volume, right? So it's no longer you have the opportunity to go see patient A, Mary, for all the time she needs from you. And then when Mary's done, you're going to go to Bill. You really have to see Mary and Bill. They're going to both come in at the same time. And then you're going to see Bob and Jane 30 minutes later. So, that starts to take, at least for me, it started to take the passion and the fire. And it felt like all of that was being muddled down to where my focus and attention and energy was being taken away from the patient care and being put into these other buckets of make sure you hit this number, you got to get volume, and don't forget the notes on the back end.
Yeah. That's what I remember seeing. And that was something I didn't like I said, I already knew because my instincts told me that you'd be an amazing therapist and that you would be an amazing addition. But one of the things I didn't necessarily anticipate was that when you came over, I do remember you were so conditioned to think about the numbers at first, even though I knew that your heart was like, I want to get people better. But you were so conditioned to think about the numbers. I remember at first you were like, Jay, like, how do I fill my schedule? How do I fill my schedule? And I just kept saying, Eric, just get people better. Just get people better. And you're like, okay. Right? Yeah. Do you remember that?
I do. Yeah. And I think, that was very challenging at first. The things about the insurance-based world, they instill these, at least for me, they instilled this drive of like, go meet this person, try to see how many patients you can get them to refer to you. And then how do you get your schedule busy? How do you make the time that you're investing here profitable? And I want to do right by you, the business owner. You brought me on. How do I show you that I am putting back into your company the effort and energy investment that you've put into me? So my mind is like, I got to get more patients in the door. How do I find this person? How do I get to that person?
Right.
And it was a hard transition, but the constant reminders of, dude, slow down. Yeah. Focus on the patient. When they're here, just get them better.
Yeah.
And then things will start to snowball and you'll see it. And once I could shift that thought process in my mind, honestly, I don't think it took me more than 2 months to get.
No, it was definitely very fast. You were great.
Yeah.
I think that what you just said is so true. It's like I think that's the biggest difference I notice is in our world, I think our cash-based practice in particular, like the model that we use may be slightly different from other cash-based practices, but it's for sure that quality over quantity game, right?
Yeah.
So, and I think I didn't realize that there was going to be a little bit of a transition for you. And actually we've seen it with some other employees too, like coming over and realizing that the whole mindset of it's really conditioning. It's like the conditioning mindset of what your focus are. And I believe in metrics, like you know, what gets measured gets done. And so I'm not faulting the insurance-based world. You have to measure things, but it's just, you have to really measure what's most important to you. And so it was definitely like I'm sure I drove you crazy. Like, just get people better, Eric. Just get people better.
Yeah. Yeah. It was hard to like adopt that, but it definitely works.
So now Eric is, just to like give you guys an update of our practice, you know, this practice, as I said before in other episodes, 2013, I opened the non-brick and mortar, 2015 brick and mortar, 2019, Eric came on. And then now since then we have 3 full-time and 2 part-time therapists and we're busting at the seams. Like Eric, as he said, he's only been here 3.5 years and his schedule, he has a consistent wait list now. So the method, you know, it works, right? So now it's funny because transitionally you've gone from coming in a director role from an insurance-based world to now being, then moving into cash-based practice and being a little bit more of a less director role and then earning your spot again. And now you're going to be opening your own office, own primal office. I'm super proud. We're working. I mean, I don't want to jinx anything and talk too much about it, but I am excited. Like Eric's schedule is slammed and our place is big, but we're looking for a new fishbowl. Like not here, this place is staying, but Eric needs a new fishbowl. Otherwise we're not going to grow. You know, fish don't grow if they don't have big enough space. Yeah. So, tell me about that process. Now you're like transitioning again into more of a leadership role. And how's that feel?
Yeah, it feels great. I mean, I definitely enjoy and love the management side of things, being able to, you know, allocate some of my time and effort and energy into not just growing my business, but helping lift others around me. So I think being fortunate enough and having the success I've had to feel comfortable, ready to take the risk to open up another office. One, helps me get a new community established where I can help more people, and then hopefully make that office busy and big enough to support the growth of other PTs.
Awesome.
So yeah, it feels great.
So I'm having a ton of fun watching you grow into your own, look for, right now Eric's currently looking for a space that he can grow his side of the business into. And it's a lot of fun for me to watch like your own personality come out of that. And I think what would be cool for the audience to hear is some more about what makes you you. Like, what do you think if you can give me like two things that you think were, or it doesn't have to be two, but a few things that made you really successful and grow in this practice and made you to the point where you're now opening your own office?
Sure. Yeah, if I think about it, I think one of the key components of success in the cash-based world is figuring out a way to become an expert in whatever it is you want to be doing. So now in the cash-based world, we have the time to put everything into each individual patient and each individual case. So the more knowledge, skill, and expertise you have, the more of an impact you're going to have on that person. So I think one of the key components of my success, when I first started on even part-time here, was going through, I'd been dry needling since 2016, and getting started, I knew I was having a ton of success with dry needling, and under some guidance by you, it was like, hey, if you're gonna succeed, you got to be the best and the expert. So I went and took that functional dry needling certification, did that, and then even from there, if you want to be the expert, you got to start teaching things. So from there, I started teaching dry needling, and that just instilled even more confidence in my abilities, the ability to deliver the actual treatment, deliver the expectation and the education to the patients, and it really made me feel like I was the expert. And when I have that skill and that knowledge, I think that's portrayed across to the patients,
100%.
and that holds true. I'm continuing to do that with some of my running clientele and patients as well, taking some running gait certifications, going in and getting this 3D motion analysis equipment to try and make sure that as far as the community is concerned, we are and I am the expert. And that can't be fraudulent. So I need to do my end to make sure I'm educating myself on those things.
I love that. That's that quality over quantity, like 100%.
Yeah.
I think for me, that's one of the biggest differences in the cash-based world is, and so it's not for everybody, right? Like if you just want to clock in and clock out and you want to, have a very anticipatory schedule, then maybe cash-based isn't for you. But if quality is more important to you than quantity, and then I think that's right.
Yeah. I think the other big picture component of this that I felt made me really successful, it has to do a little bit more with the ability to connect and create that relationship with the patient. I've, through some trial and error and experience, started to create this framework on how I wanted to approach each individual case, and making sure that patient understood what my big end goal plan or expectation was for whatever they're coming in for, right? An example would be a patient coming in, she's had knee pain for 2 years. She's seen 5 physical therapists. No one's been getting her better. And she was starting to get depressed. She's like, I don't think I'm going to be able to walk normally ever again. I'm going to have a cane for the rest of my life. And just having the time, the cash-based world, having the time to sit down and listen during the eval, get everything out of her, you start to actually hear some of these details that help you diagnostically internalize. And you're like, there's really no reason why we can't get you better.
Right.
And being able to sit there and look her in the eye after 2 years of pain and say, in my head, I'm like, all right, let's paint this big picture. What's my expectation? And I'm going to be clear with it. Here's the mountaintop. You're going to get better.
Yeah.
I am going to get you better. And what we're going to do is take this day by day.
Yeah.
So once we establish that mountaintop, what's the mountaintop? And when you set these lofty goals, and if you only focus on that mountaintop, it becomes a very daunting task. So, the message is, I know the mountaintop's up there, but we got to take that first step.
Yeah.
So when we start looking at each individual appointment now, this is where our test retest stuff comes into play, because, hey, we're going to take step number 1. And I'm going to make sure the way I'm treating you, we're going to test what's wrong, what I think is going on.
Yes.
And then literally in that moment, in that session, we're going to retest because I need you to feel that we're making a change so that we can instill some trust, some hope, and realize that, hey, if we do this one step at a time, day after day, we're making a change day one, we're going to get to that goal. And I feel like it's establishing that framework and expectation and plan with patients has been very helpful.
I love that mountain. There's so many things you just said that I love. One, that mountaintop analogy is amazing because that is what people who come to us feel, right? People always ask like, what's your number one patient type, right? Our patient types are people that failed treatment somewhere else or people that wanted to be better yesterday. And to all of those people, it's exactly what you said. It's reaching that mountaintop and it's overwhelming to think about that journey. But what you said that had this like very big visual in my head when you were saying it is all those test retests that we're doing, that we're establishing in this model that we practice is we're basically pulling out a compass. Like we're pulling out our map, we're pulling out our compass. We're like test, retest. Hey, you know what? That gave us the outcome we wanted. We're going to continue on this path. Or, hey, you know what? Oh, we're a little bit off course here. That didn't give us what we wanted. We're going to maybe veer to the right a little bit this time. And the coolest thing that I've seen, I'm sure you have too, is that patients, they're engaged and they immediately understand the plan. Yeah. Like they're looking at the compass with you. They're looking at the map with you and they're like, okay, that makes sense. Like I don't feel any different after that intervention and that retest. So that makes sense that we'll try something else. Or, wow, I can't believe my neck's moving better even though you just treated my left hip. That's great. I'm going to use that mountaintop analogy. That's awesome.
Yeah.
The other thing that you said that I think was, just screaming in my head when you were talking is back to that, like that vision and mission, that you getting your patients better, like you having that moment where you're like identifying with patients and being like, oh my God, how has she been to 5 other PTs and 2 years of PT and nothing's working? Like, how have we done her this disservice? That is, I haven't mentioned that enough on these podcasts, but I think that is a lot of where the podcast has come from, is like this new mission of helping more therapists get more patients better. Because now 10 years into the practice, I've seen that too many times, right? Yeah. And that's also goes back to when I first met you. And like, that is what I saw in you in that 30-minute session with a patient, is that vision and mission of like, yeah, I just want to help people.
Yeah. Yeah. You want to help the patient. And, you know, at least for me, when I think about myself as a new grad PT or even an experienced PT, like there might not be a worse feeling. I think we were talking about this the other day.
Oh, we were.
There literally might not be a worse feeling than being like, I don't know that I'm helping somebody.
Yeah.
I don't know that what I'm doing is actually making a difference.
Yeah.
And you're like, this treatment feels like gut wrenching because I'm just not sure I have the answer.
Yeah. That's when Eric and I will like, and even in our team meetings, like our team meetings of 5 therapists, well, anytime anybody's having, I'm sure this is typical, right? But anytime that we're having not a hard time or we're not sure we're on the right path, we pull out the map together and we're like, hey, what are we missing here? Are we missing anything? That's it for today. Like, I really appreciate you joining me on the podcast and kind of showing them firsthand how it works, how the model works. I'm looking forward to growing this more and more with you and with any other, all the therapists that are working not just at Primal, but like interacting with us on the podcast through the courses that we're offering. So I'm just going to end you guys with, if this is something that seems like a passion for you and seems like something that you want to work through in your own life, then make sure you're subscribed to the podcast. I'm literally sharing every single tip and nugget and like secret that I could. It's not a secret. It's to be shared with the world so that we can help more people. So subscribe to the podcast. Keep liking and making comments, because that helps me give you better content. And I look forward to being with you guys. And thanks again to Eric for being awesome, number one, and just for coming on today.
Yeah, thanks for having me. It's been fun.